onto the FiO2 per liter. So let's say you're on 1 liter, okay?
So 10 plus 4?
Plus 4. So then
So
5.
25%. And at 2 liters, what do you think the FiO2 is?
That's another 4.
Another
so
4.
29.
Yeah.
29.
So, but remember, it's just a guesstimate, okay? You just because these are low flow, they don't guarantee you the FiO2, okay? So it also depends on
So
how.
FiO2 does oxygen saturated, or what do you mean by that? The
Just
FiO2.
Yeah, FiO2.
Yeah.
Of course, you always have to monitor the patient.
Oh, monitor the
Right. You have to monitor the patient, making sure that the saturation, if you need to go up, then
more.
Right.
Yeah.
But at least you kind of know what the patient is getting. It's a
Getting,
ballpark.
yeah.
But with these, it depends on their inspiratory effort. Like for instance, if they're breathing really hard, they're probably going to get less oxygen because they're pulling in. Because this thing doesn't, it's just giving you kind of that much, okay? And if you're breathing normally and you're breathing at a normal rate, then you might be getting that 25% or that 28%. But if you're breathing fast, you might be getting less. Okay, so this one doesn't always guarantee you that, okay? If let's say you're going up on your oxygen, the next one that I see that we use here a bit is a simple mask. And the simple mask, the liter flow in here, you don't want it less than 5 liters, okay? So between, it says that you can go up to 10, but I read in policy that, 6 to 8. So just use it if, let's say, you need like 6, up to 6, and then 6 to 8,
6 to
okay?
8.
But with these, you have to remember that you have to put a minimum of, like I said, 5 or 6. Because if you don't, the patient is rebreathing their CO2, and they're not going to get that enough flow to push out that CO2. So they're not going to get that approximate FiO2, okay? And the approximate FiO2 you're going to get from this is about like 40% to maybe 55, 60%. And it's all remember I said a guesstimate, okay? Because these are low flow. It all depends on how the patient's breathing. But normally we don't use this on the floor. This is only, I've seen this mostly used when the patient just comes out of OR. Yeah, even in the other hospital I work at, they usually use this. We don't, use this unless, if let's say you're using nasal cannula, and the patient has some sort of an obstruction and to their like nares, or they're having surgery or some anatomical problems that they have with their nose and they can't, then you can use this. But I kind of recommend skipping this just because we don't know the FiO2 and the fact that it's a higher FiO2 than this. Maybe the patient needs something a little bit to kind of accustomed to them, like the Veni mask or the Venturi mask, which is this one right here. Okay, let me tell the parts. So I have to pull this apart. Okay, so the Veni mask is a high flow. It's going to give you more precise FiO2. So if let's say you need to use, instead of a simple mask, I would recommend that you use this. That means the patient needs a little bit more FiO2, and you want to know what the patient's getting instead of guessing what they're going to get. Okay, so with the Veni mask, it comes up in parts. There's different types of devices, or different models of it, and this is just one of them that I'm going to show you. I don't know when